I think the Internet of Things will really change the way we deliver care. And I think it's going to come in three areas. One is around the data, and the data that the devices are generating that gives the physicians or the nurses the ability to make decisions on an informed perspective in real time, as opposed to, somebody suffering from something, chart notes are written, chart is put up somewhere, the doctor makes the rounds, and they get to you 30 minutes from when they were supposed to, and all of those things. Those all go away. One of the examples was the Streams app, which basically uses AI and connected devices to alert nurses that somebody's going to suffer from acute kidney infection before they actually get the infection itself. So those kinds of things are going to dramatically change the way we deliver care, but also the impact on the patient themselves. And I think as we go forward, particularly in the United States, with outcomes-based solutions and how hospitals are being judged on whether the person is well when they leave and how well they are, the connecting with them as they go home, making sure we're monitoring them from a remote perspective so they don't have to come back to the hospital for checkups, things like that, will change the way we deliver care as well. So I think those two things really, in the near term, is what's going to really impact healthcare delivery. The third one is around caregivers and alerts to the caregivers. We are, in Western society particularly, we have elderly parents who live further away from where the children are or where nurses are, things like that. So how can we use these devices to provide alerts to people who are looking after the patients, particularly the elder generation, who are on their own in some cases? So can't, the old I've fallen down and I need help kind of device. Now it's all connected together. So that's going to be the third one, I think. When I say connected health, I mean, how are we looking at the entire patient journey from the time they get diagnosed to maybe going through treatment, to living with the disease, all the way through to caring for them if we get rid of the disease, let's say. So how do we connect all of those things? And what are the things we can use, mobile devices, apps, alerts, those kinds of things across that journey. So that's the connected health continuum as we think about it. The Internet of Things and all this connected device stuff opens up a whole new world of security and privacy. From a privacy perspective, we already give our information. It's already out there, right? It's in all the hacks that we've seen recently around healthcare, particularly hospitals, all those ransomware things. So I'm not so worried about the privacy piece of it. I think HIPAA and the rules and regulations there will take care of that. But the security is something that we should all be aware of. There are a huge amount of companies now looking at this entire area. How do I secure that device? We've seen those news, front page news on this guy's heart was hacked because he's got a pacemaker. Those things won't occur. And I think there's lots of people who are really looking at how do we make those devices secure? What do we need to do to secure the data as it gets transmitted from device to whatever app and from the app to wherever patient record that's there. When it arrives in the patient record, it's secure anyway. It is today. So I'm not really that worried about that piece of it. It's the device piece. The tangible benefits of all this connectedness fall into two categories today, and I think they'll change going forward. But today it's around public health and cost. Right? So if you get a huge amount of data and you understand that data on an aggregate basis on public health and how you can provide services, particularly for those nationalized healthcare services like the NHS in the UK or Germany or France, or even here where the payer industry is looking at all of these outcomes-based solutions, connected health helps in a long way because it gives you real-world evidence. It gives you actual data. It's not relying on surveys. It's not relying on a small population base. You can literally take data from 4 million people as opposed to 200 people and apply it. So I think that's where the biggest value is today. I think it's a generational thing of what people will buy into and what they won't. So you have to tailor the Internet of Things service offering to that generational thing. So in my speech today, I showed you how an elderly patient could interact with a voice-activated solution. Perfectly normal for them because they can't really interact with the phone. They find it cumbersome. The technology is too much for them. The millennials, on the other hand, are all text-based, service-based, chatbots, all of those things. So as we look at these things, we shouldn't say, will the Internet of Things be taken on by all individuals? I think it's a generational thing. And if if you cater to the generation in the manner that they want, then it'll absolutely get taken over. But with the Amazon Echo and OK Google and Google Home and Siri and those kinds of things permeating in our lives, it's going to start no matter what we say. The impact of all of this technology and connectedness will change dramatically the doctor-patient relationship. And here's what the small microcosm of an example I can give you. Diabetes, right? Two big things: lose weight and exercise. Maybe change your diet. We try very hard. We'll go to the gym the day before we've got the checkup coming, and then we lie to our teeth to our doctor and say, yeah, I'm managing my health, I'm managing my diet, I'm exercising, everything is good. Well, with these connected things, they'll actually know. So that whole paradigm shift will occur. Also, the other thing is, particularly the millennial generation who are adopting these bots and apps and things, they're actually tracking everything. So they're actually providing the doctor with a lot more information before they go to see the doctor. So the doctor has a very good picture of how your well-being is before you go see them. So those are the changes that will occur very quickly, I think. So pharma has a really interesting conundrum at the moment because they are a model of creating pills to give you, or some medicines to give you to manage things. And now you're going as a patient with all of these connected devices and wearables and sensors, managing your health yourself. So where does pharma fit into that equation? A lot of companies are looking at beyond the pill services. It's easier for device manufacturers and those pharma companies that have device delivery mechanisms for their medicine, the insulin pumps, those kinds of things, because you can say, you know what, I'll make it an intelligent device so I can give you more information. When should you get your insulin? When is the right time to do it? In the diabetes example I showed with the Alexa, right? When should you be able to get more strips because you're going to run out? So those kinds of things. So pharma could play a role there in helping you manage your life, but I think it's still going to be difficult for pharma to figure out what beyond the pill services they offer if the only thing they're giving you is a pill. So what can you do over and above the pill, and how do I interact with you? And I think the answer lies in two places. How do I help you live better with the pill as well? So can I give you things, if you're a diabetic, to remind you to exercise, stand up and walk, go for a walk outside, those kinds of things, while you're taking my medicine? The second one is education. As we're tracking things, you can say, this medication is helping you do these things, or it's changing your blood pressure in this manner. So I think that's where they should start, in my humble opinion.